Across the United States, there's a mighty force of health and food safety educators who take the science-based message of safe food handling into schools, grocery stores, food banks, child care centers, farmers markets, and other places where consumers purchase and prepare their meals. These health educators empower consumers to do what they need to do to lower the risk of food poisoning for themselves and their families at home. We're proud to support their work. As the Partnership for Food Safety Education, a network of nonprofit organizations, industry associations, food companies, consumer groups, and federal government agencies, developing and promoting effective educational programming to the public about food safety. The collaboration among these committed partners is a story of success that began some 15 years ago with the Fight Back campaign and our ever-popular mascot, Back. And now we've grown into a legion of back fighters in every state in the country. Today we celebrate all of you who educate consumers about their important role in food safety. Your unceasing efforts every day help strengthen the chain of prevention in food safety and shape a healthy, food-safe future for American consumers of all ages. You can count on the Partnership for consumer education materials, evidence-based messaging, and support for your events. We're here for you.
Well, that's one of the great things that the partnership was formed to do. First, so that messaging was consistent, but also that great design, tested material built around the core four messages of clean, separate, cook, chill would be made available free, both for consumers and also for health educators.
The partnership is in a very unique position because it has consumer groups, food industry groups involved, and the partnership is able to work closely with government agencies to promote food safety. We are all able to provide a concise message, which is not kind of a mixed message, and we're all saying the same thing at the same time to the consumers.
At the Partnership, our commitment to serving you took a giant step forward with the adoption of a new strategic plan aimed at achieving our Healthy People 2020 food safety goals. And we've been a leader in promoting the Food Safe Families program, developed jointly by our federal partners, the U.S. Department of Agriculture, U.S. Food and Drug Administration, and Centers for Disease Control and Prevention. We're proud to say that within a couple of months of its launch, there were 5,000 downloads of material from the Food Safe Families website. We launched an interactive community website in 2012, established a LinkedIn group called Team Food Safety, and expanded our offerings of webinars, conferences, and knowledge exchanges for health educators. We added new programming and educational materials targeting specific audiences. We built an online library of home food safety myths and facts and started the Cook It Safe program, as well as the Produce Pro program for educators and food retailers. And the Partnership has been quoted in national magazines such as Fitness, Real Simple, HGTV, and Bon Appetit, plus the New York Times and Wall Street Journal, all with the goal of reaching as many audiences as possible with the message of safe food handling and its link to good health. Come on, let's say it together.
Clean, separate, cook, chill.
Clearly, the word is getting out. Now, more than 75% of shoppers surveyed recognize that food-related illness is a serious threat to their health. A study by the University of California at Davis showed that 2/3 of consumers surveyed wash their hands after handling raw meat. But the challenge remains. For each reported case of E. coli or Salmonella, more than 24 cases go undiagnosed. The Centers for Disease Control says that lab-confirmed infections of E. coli were unchanged in the years 2006 to 2012, and there's been a 75% increase in reported Vibrio cases. So there's a lot of educational work yet to do.
The challenge for all of us is to continue to innovate and participate. We must act on what we know works too. So we must keep finding new ways to encourage and equip Americans to do the tried and true food safety practices as well.
We have increased our partnerships. We have been going out to talk to more groups that talk to our at-risk audiences. We have been doing a lot of push in getting our materials to community health organizations, doctors, nurses, people who could really talk to these patients. We have been doing a lot with daycares because we understand that daycare providers are really good in talking to the parents or even adopting our practices at the daycare environment.
Today we applaud all of you and celebrate you for your dedication to the goal of a food-safe America. And we thank you for what you do every day.
The backfighters, they are a critical component in this because without them, we're not able to carry the message to the people, to the consumers who need it most. Keep up the good work, and on behalf of the Food and Drug Administration, I want to thank you all for the awesome work that you do every day.
Keep running this race and don't give up, even when you feel frustrated or tired. But we need to keep plodding forward with our work. Americans are counting on all of us, even if they may not know it.
Please think on those people that you really reach through your message. Those people that change their behaviors, those people that actually were checking on recalls. Think of those people that did not get sick because you.
Really what we're working to do is to give the backfighters the support, the knowledge, the materials they need. I want to thank the backfighters for being at the conference and for coming together. It further shows your commitment. You are the leaders in this room, the leading researchers, the leading developers of programming, and it's a great honor to be part of a not-for-profit that serves you.
Well, Shelley, that was a great piece that you put together. And this session is really about you, the backfighters, and to say thank you. I'm Mary Pat Ramonde, and I represent the Academy of Nutrition and Dietetics, which often I say is a great job because I represent 75,000 really good-looking dietitians. But during this conference, you're going to see some of the examples of the professional societies. And so some of the things that the Academy is doing, and you'll get to see it tomorrow, for example, is our home food safety program, which we are very proud of. And one of the things that struck me about our home food safety program was we had a special part for college students. And I thought that was really unique. If you ever have walked into your daughter's college room, you realize it could be a food safety project. So we also have a commitment very much in the Academy on our legislative priorities. And one of the things that has been very good for me to be able to do for you is to go to Capitol Hill and the federal agencies and promote your message. And promoting your message means that often it results in funding. And because I think you deserve the funding you need to do your jobs. I'm proud of the Academy member leaders, two of whom you will see, Dr. Hillary Thusman and Dr. Mildred Cody, which we all call Missy. But their work has really gone beyond just our association, and I really am proud of their work. But there's other groups that are professional societies committed to this. IFT, who is my colleague in the International Food Technologists. Food technologists keep us current on what's going on in food safety and how to keep things safer. I have to call out the IFIC Foundation also. They are very, very good at sharing with us consumer research. And as you've seen this morning, it is about getting in the minds of the consumers to really understand what's going on. Finally, as a former director of the Food Nutrition Program at the University of Minnesota, I know firsthand how important what you're doing every day makes a difference. And I can tell you a story that changed my life, and you might have heard it, but in 2009 there was an outbreak of peanut butter, and 3 people died in Minnesota. And one of them was a mom who was in a nursing home for a very short time for an infection. And the last thing her daughter did is make toast for her mom, who loved peanut butter, and said, "Mom, I'll see you tomorrow." Well, she never saw her mom tomorrow because of the foodborne illness. And on the way home, because we had a small group meeting with this family, I realized one of my friends ordered that peanut butter as the dietitian at that long-term care facility. And that's where the impact of foodborne illness hit me. And I realized that perhaps the fight back wouldn't have been able to prevent that. I get that. But as what you do, and I've seen it every day, you do a lot. And you do it because you are committed to it. So on behalf of the professional societies, I just want to say thank you.
Good afternoon. I'm Hillary Tesmar. I'm the Vice President of Food Safety Programs at Food Marketing Institute. And we're proud to be a champion for food safety and a partner with the Partnership for Food Safety Education. Consumers are everywhere, but reaching the consumer can be the most challenging audience to reach and the most challenging audience to craft messages for. Companies who make and sell food care deeply about food safety, and they put forth significant effort to sell safe and wholesome products to their customers, friends, neighbors, and families. It's the food industry's job to prevent contamination in the first place. I'm going to repeat that because it's so important. It's the food industry's job to prevent contamination in the first place. It's also our responsibility to make sure that we provide science-based information to consumers to reduce the risk of foodborne illness. To accomplish this goal, the Partnership for Food Safety Education is the perfect organization to work with, since it's a public-private partnership of industry, government, scientific, and consumer organizations working to develop the best consumer-friendly messages based on microbiological science and behavior science. Thank you.
Good afternoon. My name is Tom Super, and I am Vice President of Communications with the National Chicken Council here in Washington, D.C. You might read in your program, I am not Steve Larson with the National Pork Board, who unfortunately could not be with us here today, but I am happy that the original white meat could substitute for the other white meat today. First and foremost, I'd like to start off by saying I hope you enjoyed that nutritious, delicious lunch entree this afternoon. For those of you that are watching on the internet, it was chicken. I'm here on behalf of the 250,000 men and women and 25,000 farm families who work every day to provide us with chicken on our tables in a sustainable and affordable and, most importantly, a safe manner. NCC has been a contributing PFSE partner since its inception. But I'm also here to speak on behalf of all of the commodities, poultry, red meat, fresh fruits, and vegetables, who are working together to ensure food safety education is science-based, easily accessible, and widely available to consumers, families, food service, and retailers. I'm also a dad to a 7- and 5-year-old kids who just so happen to eat. So this is an issue that is both professional and personal to me. When the partnership was formed in 1996, the commodities were all at the table, and we remain there today. We are investing heavily in food safety research and investing in the best science and technology available to build on the progress we've made in reducing pathogens on our products. But there's still more to do, and we will do more. We feed Americans, and we help feed a world that is going to reach 9 billion people by the year 2050. We are committed to the good health and safety of all those that we feed, and that's a responsibility that we all take very seriously. And remember, we're consumers too. Even with very low levels of bacteria, there is still the possibility of illness if a raw product is improperly handled or cooked. That goes for poultry, pork, beef or broccoli, and whether that's organic, conventional, if you purchase it at the supermarket or the farmer's market. But there are steps people can take in their home, in their kitchens, and in food service establishments to significantly reduce their risk. That's why the work of health and food safety educators and the backfighters is so important. All parts of the food chain need to engage in consumer education in order for us all to be successful. Because one illness is too many, and preventing one is priceless. I want to echo my colleagues in thanking you all for your hard work and for all that you do. Thank you.
All right, I'm not a choreographer. We have a video coming up. It's featuring a backfighter. We'll actually have 2 of these videos that feature people who do consumer food safety education work. Is there a problem? Should I go to the slides or should I? Okay, I may just stand up here then because I'm then up next. Are you going to mute to the slides? All right. Why don't we go to the slides and you guys can figure out the 2. We have videos, as I said, short videos about backfighters. I'm again Shelley Feist, and one of the things I talked about earlier in a breakout, and that's being released today to the media, is the results of an environmental scan that we commissioned with North Carolina State University. So today I want to talk about who are the backfighters, who are the people who are doing consumer education, to give you a real rundown of what we found, and to tell you that we intend to have an ongoing dialogue about these various consumer educators, their needs, and the programs they use. The partnership works hard to be your trusted partner. We communicate each week with about 14,000 health and food safety educators, and we call them backfighters. In preparation for this event, we wanted to take action to identify this wider array of people and organizations engaged in consumer food safety education who may not be in this backfighter network. So again, we worked with NCSU, with Ben Chapman, and with Nicole Arnold. on this environmental scan, and nearly 400 individuals responded to an online questionnaire. We looked at these sectors. We set out to find the people who are engaging with consumers in these sectors, and this may not be the only type of work they're doing in consumer education, which is why we were so interested to find out who is educating consumers and how. And why did we do this? We were looking to identify as many of the robust sources of consumer education and outreach programming as we could in the United States, because it's very important to how the partnership does its job and how we plan for the future, and the goal we all have, which is to strengthen consumer food safety education and to make progress against those Healthy People 2020 goals we talked about early today. So we, the partnership, have 3 strategic focus areas, all of which serve to support this work of health and food safety educators and, in turn, consumers. We convene and support practitioner communities inside and outside government. We do it in forums like this big meeting, but also convening experts in the sciences and in communications. We amplify these collective efforts of thousands of partners and educators and help them tell the story of the impact their work has on protecting the health of consumers, and we need more of your involvement to do that. And we are working to lead efforts to evaluate the impact of consumer food safety education and to anticipate needed changes in program approaches that will better align programs with intended outcomes. So let's look at a few highlights from this environmental scan. First of all, the big 5 sectors of activity won't terribly be surprising to most of you. Academia, which includes cooperative extension, which you should get a big hand for them in here. You're all in here. And the number one source for consumer educators is within cooperative extension that we found. At public health, all levels of public health system are involved in consumer food safety education. County public health agencies appear to be the most active in this area of food safety education, and with local public health agencies also involved. Schools, those who are introducing kids to food safety, appear to be family and consumer science teachers based on this scan that we did, and also people involved in school food service are actively involved. In the federal government, you know there's a lot of great, robust programming in the federal government, engaging multiple agencies, USDA, the FDA. A lot of work came through the Expanded Food and Nutrition Program, or FNEP, and the Supplemental Nutrition Assistance Program, or SNAP-ED. It's really making a difference with important audiences of parents who have young children at home. And FDA and their network of public affairs specialists, also very involved. And in nonprofits, there was a great variety of types of nonprofits that are doing work with consumer food safety education. Many of them that are agencies caring for the broader health and wellness matters of American families. So people in congregate nutrition programs and nonprofit providers of child care services would be examples of those people in the nonprofit sector. So again, we released the press release and infographic. You can get them at teamfoodsafety.org. So what channels are these educators using to reach people? I think this is kind of amazing because food safety education is being done face-to-face with consumers overwhelmingly, and that's across these different sectors. As you can see, very high numbers, both academic, so cooperative extension, but school setting and in public health. So that's a very interesting part of the story in a digital age where we think everybody's communicating through the internet and social media. Online, you would think would be pretty big, right? Well, it shows the federal government at 52%, as this being a channel they use, cooperative extension 38%, and nonprofits 34%. Television, well, everybody wants to be on television, but few can afford it. The federal government leads in work to reach consumers through television with safe food handling information. And as you see, cooperative extension at about 7% and school systems at about 4%. Finally, there's a lot of other channels that consumer food safety educators use, and variety of channels, and including various print and other forms of in-person connections. So what else did we learn from this scan? Well, importantly, we learned that about half of educators are able to or are measuring impacts of their work. But regrettably, this means about half either are not doing it or are not sure they're doing it. So this is an area we all intend to work together on, improving evaluation. And finally, some other takeaways. The federal government is reaching the most people on an annual basis, and I think if you've visited foodsafety.gov and any of the other and the agency websites, you'll see the fantastic depth of information and services being offered to consumers, things like Ask Karen, where a consumer can query a database with questions. Children and households with children are primary targets of consumer education, and this is great because, of course, half of all hospitalizations from foodborne illness are children. And we need to do more to engage food retail and the food industry overall in these preventive health efforts and to capture this information. So I want to thank you for this opportunity to share a little bit about what we learned in the environmental scan. And keep your ears open for information on a webinar event in February, where we'll dig deeper into this and get you all more involved in talking about some of the ways we can plan for a future of robust consumer food safety education. Ready now?
Rachael Manson. I'm a National Board Registered Environmental Health Specialist, and I work at Henry County Environmental Health in McDonough, Georgia. This year, we estimate that we'll reach roughly 6,700 people with our food safety education information. Our audience today is comprised of daycare centers and home daycare center facility workers that work in the kitchen and that operate the daycare centers. We use materials from fightback.org and the Partnership for Food Safety Education. They provide awesome tools.
Practices in child care centers on the fightback.org website.
We have received very helpful feedback and data from our evaluations. Over 90% of the reports that we receive back say that they'll conduct more food safety trainings with their workers and the children and the parents as well, so that's a plus. My motivation is that we save lives. One consumer, one child care facility, one kid, one restaurant at a time, period. My message to other backfighters is don't stand back, fight back.
Good afternoon. My name is Dana DeZidel, and I am 17 years old and a junior in high school. 14 years ago, my life changed forever, all from the simple act of eating cantaloupe. A stomach ache led to a 104-degree fever, bloody diarrhea, and hospitalization where the doctors questioned whether I was going to survive. An initial diagnosis of Salmonella puna blood poisoning led to a secondary diagnosis of reactive arthritis. Despite the challenges I face today and in the future because of the reactive arthritis, I feel blessed. Blessed because I am a survivor of a foodborne illness, and blessed because I can turn a challenging situation into an opportunity to make a change and hopefully make a difference. My inspiration for continuing to support the efforts of food safety and for writing my children's book, Food Safety Superstar, comes from my little sister, Jenna. Jenna is 8 years old and is in the 2nd grade. I would never want Jenna to go through the pain and suffering that I have. I can never imagine Jenna not in my life. I was 3 years old when I ate the cantaloupe that changed my life. It was when Jenna turned 3 that I started to work hard to share my story in hopes of making a positive impact for change. I've shared my story at speaking engagements across the country, participated in numerous print and television interviews, yet my greatest accomplishment is writing a children's book. My intent with this book is to educate young children on safe food practices, to remind them to always wash your hands, make sure cold and fresh food stays cold so they don't get old with mold, clean your counters and tables to keep all food safe from germs and grime, and make sure all the food you eat is cooked to chase the bacteria away. If I can help people be food safety superstars, then I will feel blessed that I have been able to make a difference and fight back. Thank you.
This is the the Champions for Consumers segment, and we have 4 contestants. Do we have the Jeopardy board? No. All right, well, we're wrapping up the day, and at this point in the program, I'm going to pose 2 questions to each of the 4 panelists and try and get some feedback from them. And then at the end of this, we're hoping that you'll take your answers to these questions and post them on the board that is directly outside.
Yes, we wanted it in here, but it is out there.
But it is outside, yep. So I guess and we'll start with Marjorie. What do you believe to be the greatest successes in food safety education over the past 10 years?
Well, I think one of the greatest successes over the last 10 years is the increase in collaborations on food safety education. And I think all we need to do is look around this room for proof of that. We've collaborated on message development, on the research base, on program effectiveness, and our programs are all stronger for having done that. I just look at some examples that we've done at FDA, where we've worked with USDA on information for folks at risk for foodborne illness, and then we've worked with the partnership, as well as industry and academia on produce safety messages. We've worked with the National Science Teachers Association on developing continuing education programs on food safety for teachers. We work with Rutgers and our Risk Communication Advisory Committee on risk communication messages. And we've all had stronger and more effective programs because of that. And I think it's been a huge success and needs only to continue.
Thank you. Our next contestant. Again, what are the greatest successes in food safety education over the past 10 years?
Good afternoon. I'm Maria Mulligan from USDA FSIS. I'm the Director for Food Safety Education over there. I have to coincide with Marjorie. I have been thinking about what is the greatest success, and I came to this program a little bit over a year ago, and I am so glad that I have found an environment of so much collaboration, so much camaraderie. I have been working on other topics in the federal government for over 10 years now, and I don't think I have ever found a network of so many people trying to work under the same goal. We have industry partners, consumer groups, academia, and federal agencies working together. I think our collaboration with CDC and FDA is fantastic. I have to say, particularly with FDA, we do a lot of work because we have to do a lot of education per se. And from the work that we do together in writing and preparing products for foodsafety.gov, where we try to bring one voice all the time, we understand that each agency regulates and oversees several certain products, but we try to talk all the time under one voice to our hotlines, which work together all the time, like our hotline at the Meat and Poultry hotline and the FDA hotline. I have to say that we have never turned down a consumer question just because it was not related to our topic. We do the best to work for the consumer together, and I really appreciate that environment, and I think that's part of the success that we are having with food safety education. Today, it's having the public, the private, and the nonprofit sector working together towards the same goal.
Very good. Christine?
Okay, you are my witness. I have my answer written down, and it's really the same answer as the so we did not coordinate our scripts either. So I'm Christine Froh. I'm the Associate Director of Behavioral Science at CDC, and I've had the pleasure of working on food safety for the last 5 years. So I'm a newbie. Some of you guys have been around forever. So I'm a new player. But the thing that I've observed in my short 5 years is that, and I wrote, sustained collaboration and commitment to food safety. I think that's a big deal nowadays because there's always new issues and new problems and new challenges that sort of try to get our attention. The fact that food safety hasn't dropped off the radar screen on the political agenda or the public agenda or even consumers' minds. Well, we're not top of mind for consumers. We're not off their radar screen either. And I think given all the noise and all the distractions and all the craziness of the lives that we lead, the fact that food safety is on people's minds and is on their radar screen is a testimony to this group's commitment to keeping it on their radar screen and keeping it in the scheme of things. So I think that's a big deal, and I think the challenge is to keep that commitment going and sustaining it and re-energizing ourselves for the future.
And last but not least, Shelley?
Well, thank you. I had collaboration. I had 3 points. Of course, I had more than any I should have had. But collaboration is one of them, and understanding that being in the food industry, and I feel this has really come out of the food industry, that providing safe, wholesome foods requires a commitment to investment in all parts of the food safety chain. I think that's a really important thing, and that's something we really work hard on, so that companies who have very strong values around food safety, that they understand there's a way they can be involved with the consumer education. I think that's an important development that maybe wasn't always there as broadly as it was before. And then I'd say some of the system strengtheners. I mean, when I think about FoodNet and how in the data and having faster access to some of the detail, even though it is, of course, just outbreak data and we're still missing maybe some of the picture, but I'd say the addition of that and of the Healthy People 2020 objectives give us a great framework and give us more immediate data that I think helps educators to look at what's happening with foodborne illness and where we need to do more work.
Thanks, Shelley. I think one of the takeaways that I have is that we may be able to continue monitoring the level of foodborne illness that may be occurring, but one of the things we're not measuring is the number of foodborne illnesses avoided by all the work that this group, this community has carried out. And that's really hard to do, especially considering the increase in the variety and sources of foods. And so I don't want us to lose sight of that hidden success, but nonetheless, we remain committed to getting foodborne illness down to 0. We'll come back here to Marjorie, and we'll get the next question, which is, what do you see as the greatest areas for accomplishment and success in the future?
Well, I'll echo Chris's comment. I think our biggest challenge in the future is to sustain the food safety education momentum that we have going now. Our FDA's research shows that consumers, even if they know about safe food handling practices, need to be reminded to follow them. So we need to work very hard to keep these messages top of mind, and so consumers keep following these practices. And there will always be new audiences in the future. There'll be young people who will be coming of age, starting to prepare meals for themselves and for their new families. And we also will have people coming from other countries who may not be as enlightened about food safety. And a huge demographic in our future is a large number of people who will be older Americans in the next 10 years and who will be at risk for foodborne illness, and we need to make them aware of that fact. So I think continuing the momentum for food safety education will be our biggest challenge, and I actually have faith that we will.
Terrific. Maria?
Yes.
What do you see as the greatest areas for accomplishment and success in the future?
Well, I think, as I say, there's a lot of collaboration that we have done, and I am really happy about that collaboration and a lot of successes that we have had on foodborne illnesses. However, there are certain areas that we can still improve, and as Marjorie says, several audiences that we have to work with. Our research, as Marjorie mentioned, shows like certain gaps in terms of older adults and small children. And definitely some of our, I will say, some of our informal research, or not informal, some patterns that we have seen in focus groups is people who are more educated or higher income. They think that they don't need to follow these practices, or they think that they know everything. So part of the of my future efforts for next year is explore on some of our next research projects those areas, because I have some concerns about what families are showing their kids and teaching their small children, particularly in certain income and certain education groups. Also, I think big part that I think we need to explore, and we have been actually talking about that lately, and we, like FDA and FSIS plan to have a little talk about this next week. It's food thermometers. I think we all agree that research shows that from the 4 steps, cook is the one that is the lowest, and the usage of food thermometers, depending on the research, shows that it's between 15 or 35%, but it still is extremely low in comparison with others. Just recently, we have been analyzing some data with Kansas State University, and we also saw some interesting results in terms of the usage of food thermometers in younger demographics. So we know that there's a lot that we can do on that particular step, on the step of cook, and that's something that it's a big initiative for us, and I hope that we continue exploring that in the near future, because it's a big challenge.
Thank you. Christine?
Okay. 3 words that summarize my thoughts here: design, behavior, and proof. I think we need to be looking for ways to design or engineer food safety across the whole farm to fork continuum. If we can make it something people don't have to think about, that would be lovely. So let's design a refrigerator with a meat drawer on the bottom. So you don't have to worry about dripping on fruits and vegetables. I mean, I think there's just lots of opportunities. Okay? And then where design ends, I think we need to take our tips from social marketers, and I think of Bill Smith's call for all of us to think about how do we make behaviors fun, easy, and popular. And Frank talked about this at lunchtime. I mean, the whole notion, food is fun. So why can't food safety be a lot more fun? And I know you guys have a lot of fun with kids and the people you reach, but you know, we can make it a lot more fun. We have to make it more easy, because complicated people give up on complicated or difficult, and that's why I'm not an iPhone user, but I'm not iPhone user because I have it, but I don't know how to use it. So I mean, someone show me how. I mean, we have a culture that embraces a lot of technology, and why can't that technology make its way into the kitchen in a way that people use it? And I'm hopeful that this younger generation, who seems to just glom onto cool technology and run with it, some of that technology can make its way into food. Into the kitchen. And then popular, the notion that doing the right behaviors is the cool thing to do. And Frank talked about that today. It would be very uncool to not put your thermometer in your chicken or your turkey or your burger or whatever it is you're cooking. So I think we have work to do on that front. And then lastly, you know, whether it's the design or engineering solutions or the behavioral solutions, we've got to do a better job of proving that it works. I know there's been a lot of sessions here on evaluation and effects. We do have to build a case for what we say is works actually does work, so that we know that we're not doing unintended harm to people by telling them things that may not work, because that's kind of not fair. If people are doing what you told them to do because you say it works and then it doesn't work, they get angry. I get angry. So I think we have to do a better job proving that what we're telling people to do is actually effective.
Shelley?
Thank you, Stan. Well, I guess I'd have to say, because the scan's fresh in my mind, but our strategic plan is also always fresh in my mind, which is that there's more that needs to be done to help have a dialogue about evaluation and what's practical, not practical, what we actually can show as impact and what we may never be able to show, and just really help educators with tools and know-how to do that. I mean, we have the people who are expert in that. Some of them presented here. So doing more to spread that language and maybe making it easier to do, and then figuring out what it is we actually can and want to measure. And then I'm also thinking about this sort of greater consumer orientation to self-care and wellness, and how it still feels like food safety gets separate from some of those conversations. And so, are there ways we can help consumers? Marjorie talked about sort of the, your chain of life, or people say, and your risk changes, and when you have young children, you're going to have a different orientation to this than if you're, midlife adults who don't have children at home. So maybe there's more we can do around that, and then around modeling behaviors. I mean, everybody thinks it would be great if all the television chefs were were modeling all this behavior. That may not happen. So are there other things we can do to model that behavior? Retailers maybe can be a part of that, and all kinds of folks who are really talking to consumers about what they're cooking at home could help with that.
Thanks, Shelley. I'm encouraged about some of the actions being taken by the folks outside of this room, namely the FDA, in the Food Safety Modernization Act, is trying to control pathogens and other issues that can affect food safety that are really outside of the control of what you do in the kitchen, such as the cantaloupe. And that is something that I'm really glad to see, that is a collective effort with the federal agencies, both on FSMA and things like the use of antibiotics. And those are efforts that we should take comfort in that collectively we're all working toward the same goal, to minimize or eliminate the introduction of pathogens into the home, and then if they do get there, how to handle them properly. And so I think this is a long-term effort, but I'm very encouraged by all the backfighters who are so committed to doing the right thing. So I want to thank our panelists, and hopefully you do as well. Your questions? We have some time for questions, and start thinking about the question or the answers that you're going to post on the board as well. Please feel free to use either of the microphones to pose a question. What we'd like you to put up on the board is an answer to the question of what you believe to be the greatest successes in food safety education, and secondly, what are the greatest areas of accomplishment or success, or even challenges in the future? So those two questions. And I believe that there's a tweet.
Tweet it. Hashtag. There's your slide, Stan.
There it is. Share with all of us. You or your organization's greatest accomplishment in food safety education. You can tweet it using hashtag #backfighter.
The light's right there, so he might not
Yeah.
be able to see you.
Okay. Introduce yourself, please.
Oh, sure. Barb Wallcheck with RTI International. So I had just a couple of, they're more comments, but first I wanted to talk about a little bit about thermometer use, because it's something that I think is really important, and I'm glad it's on your agenda. The challenge, of course, is one, getting people to use thermometers. But the other challenge, and I think I've raised this before in public arenas, is even if you want to use a thermometer, it's actually hard to find one. This is one of the things that I do. When I go out to the store, I go and look for a digital tip-sensitive meat thermometer. It actually can be kind of hard to find. So when we're thinking about risk communication and trying to address thermometer use, what are we doing to increase the availability of thermometers so that people can actually use them? And the other problem that we have with them is they typically last about, depending on how soon somebody drops it in the sink. And I have kids and I always have a stash of them, but it seems like they're always breaking. The other thing is I think one of the speakers earlier today talked about this concept that people think that bad things happen to other people, okay? And I don't know how many, I've been personally impacted, my family's been personally impacted by foodborne illness. And how do you, that's a culture change, and I often run into it particularly with the local small food, the foodie community. I live in Chapel Hill, so North Carolina, which is a foodie community. And there is this tendency to think, well, I'm a good person, so foodborne illness isn't going to happen to me. And my response is typically, well, the bacteria don't know that. So I wonder what are the agencies and what do you see as the role for the people on the panel for how do we address that issue? Thank you.
Well, for the first question, I just have to say it has been a big priority of us to educate people more about the use of food thermometers. And we combine that message with the salmonella message on our new PSAs. And if someone was in the panel that I was part this morning, probably you saw our new PSAs for the Food Safe Families campaign. The Food Safe Families campaign is a collaboration between CDC, FDA, and USDA. And the Salmonella/Cook PSA, it's focused on that. It's focused on why you need to cook all kind of meats, in that case chicken, to the right temperatures, use a food thermometer, and we close with pretty much showing a food thermometer under 165 degrees temperature during the ad. So that's a big first step that we wanted to make it very clear, the use of the food thermometer and the need and the why on our PSAs. We have been continuing that with our messages to traditional media, social media, and to our partners to at-risk populations. But we are definitely going to start doing more efforts. That's why we want to collaborate among agencies and come with like other ideas that we can implement over the next year. We're also exploring partnerships with retailers and with members of the industry, I don't know, like stores or thermometers manufacturers. That's a project in the agenda for this coming year, is to start some exploration on how to initiate partnerships with retailers. Maybe because like the key is maybe just make it more available in the store. And there are stores just such like Walmart that they are airing our PSAs. They air our past PSAs and they are now airing our new PSAs. And one of the things that I have told them is like, well, it would be fantastic, like if in a way to enhance this collaboration, you could also, I don't know, place food thermometers, cutting boards, and other things that related to food safety next to where you are playing the PSA. So those are ideas that we are definitely going to explore.
Barbara, I have the sick habit of going into grocery stores and looking for food safety items as well every time I travel. And I don't know, just a weird habit, hobby, that's what I'll call it, a hobby. And I haven't seen what you've experienced in North Carolina. I'm always finding thermometers and cutting boards and the colored coded other things. So I wonder if that isn't a research question to ask, is what is the availability of food safety sort of gadgets in various, I mean, if there's differential and there's differential access to those things, that would be important to know as well. I think grocery stores could do a great job of combining the sort of the tools with the products. And I know there's some probably reasons they don't do that because they don't want to scare people away from buying products. But it would be nice if we figured out a way to sort of find the win-win on matching, you know, the turkey and the thermometer at Thanksgiving, or the chicken thighs thermometer when we know that, or wings Super Bowl time. It would be nice to figure out what are some win-wins in matching the product, the gadget, and the food that it relates to in some pretty creative ways. The second part of your question was?
It was about audiences that don't want to follow our recommendations.
Yeah, I mean, we try to emphasize in all of our messaging at CDC that, you know, everyone's at risk. I mean, I think, and it is hard to sort of remind people that, yes, there are people who are at high risk, but everyone's at risk. Bacteria don't discriminate. So I don't know, we have to figure that one out a little bit more. I mean, you're absolutely right. Everyone's at risk.
It needs to be figured out, but as I say, we put that in our priorities for some research that we're conducting over the next couple of months. We are going to pursue it's usually the at-risk audience that definitely you have lower income or language isolated communities, but at the same time we've made a point to include in the research communities that are more educated, higher income, to see what their response to the messages is, because just coincidentally, we found that during research this year, where pretty much we were testing our PSAs and we had answers like, well, I don't need this, because I remember, and I'm looking at someone from my staff in the audience because she was with me when someone say, I don't need this because I shop at Whole Foods. So.
One of the things we also do is that sometimes, you're absolutely correct, people will never recognize that they are at risk for foodborne illness. But we also remind them that almost everybody is caring for someone who's at risk for foodborne illness, whether it's a small child or an older parent. And if we can't get the message effectively to them directly, we'll get it to them that way.
Stan, Jacki Sneeder, Public Health Inspector, Calgary, Alberta, Canada. And one of your pre-panel speakers was Dana, and Dana shared with us that she wrote a book. I wondered if she could tell us where we could get her book.
I could talk about that.
Sure.
Okay. So we've been talking with Dana and her mom about if we brought her here and she talked about the book, that you all would want to know where to get the book. So watch your email, because the partnership will with working with the family, make a high-quality PDF available. But whether it's going to be printed, we would not be distributing print copies, but we may be able to get you a high-quality color PDF that you can then use in your education. So watch your emails from the Partnership for Food Safety Education. We'll let you know when it's ready.
Hi, I'm Suzanne Cripple. I'm the Food Defense Program Manager for the Cuyahoga County Board of Health in Cleveland, Ohio. I wanted to stress to everyone that from our perspective on the ground, food defense is something that isn't brought up a lot during food safety and the research. We had a Homeland Security grant, and we went with hidden cameras into commercial food establishments at the retail level, mom and pop shops, as well as just a variety of different institutions and what have you. And we found that it was frighteningly easy to enter these facilities unannounced, with no ID and no nothing. Of course, we work with law enforcement, so we wouldn't set off triggers just in case of do-good or 911. So we were just sort of wondering what the partnership is doing relative to food defense, and if more programming for the general public to just get the eyes and ears of the public, because that's the only good thing, I think, out of all this crazy social media. I mean, there's so many bad things that hurt us in public health that work against us. I know I learned a lot yesterday, thank goodness, about how I can use social media more positively, but we would like to sort of get things out without inflaming or making people freak out, but yet get the messaging to them about what people's responsibility and roles can be in food defense.
Sure.
Well, from the partnership standpoint, I would say that our work is really in actionable messaging for the consumer about reducing their risk at home. So I would say we'd want to defer this to the FDA. So Marjorie Davidson's here from the FDA.
Thanks, Shelley.
I think it's in
we actually have extensive programs for industry on food defense and food safety. So I would actually recommend, if you want to get consumers active, they might be able to remind these companies that these materials are available for them to use, and we're happy to help them use them.
I guess if you see something, say something.
But we do have a really extensive website on materials for industry, so I'm sure they would welcome them.
Over here.
Hi, my name is Erin Roberts. I'm a program analyst for the National Association of County and City Health Officials. So this morning, that discussion around raw milk kind of got me thinking, and I have this question that I think applies to many aspects of public health, and as food safety educators, I'd really like to hear your thoughts on, for instance, when you have a population that has this set of values where they're going to drink raw milk no matter what happens, is it important, given the muddied waters and all the information, to stick with a hard line, to stick with what we recommend no matter what, or to modify some of that language to try and kind of modify the risk without necessarily removing it? So kind of thinking of that group, if you're going to drink raw milk, then these are the questions that you need to be asking the people that you're procuring that milk from. You need to treat them the same way you'd treat any other retailer. I guess I just am wondering your opinions about that.
I dabbled into the raw milk debate a few years ago when CDC and FDA were getting a lot of, why did you just say no? I mean, our just say no is our don't drink raw milk. And we're getting creamed in social media and other stuff. So I was able to talk with some folks who had consumed raw milk and nearly died, or had children nearly died. And I said, help me understand your motivations for consuming raw milk. Because I don't think people say, I want to kill my child, or I want to hurt myself, or, that's just not where they're at. And all of them said, I thought I was choosing raw milk for health-enhancing reasons. It's a whole natural product. We have some of these cognitive patterns in our head that thinks whole is healthy, and there's a lot to that. But at the same time, every single one of them said, I did not know a thing about the risks. So CDC actually redesigned our website to start with acknowledging the noise or the language out there, because there's a whole industry out there promoting the health benefits of raw milk. It prevents autism, it prevents eczema, it prevents all this stuff that we know as public health folks doesn't have an evidence-based claim to it. But that's the noise, that's the marketing of this product. And then you throw on top of that my right to choose. I think we need to be looking at this as from the right to choose perspective. FDA put out a book a few years ago on how to communicate the risks and benefits effectively, because we live in a culture where people want to make informed decisions. So let's start with that approach. So you want to make an informed decision, here's the risks, here's the benefits. And acknowledge the perceived benefits along with what we know are the real risks. And a lot of our communication doesn't do that. It's just very one-sided, and we need more two-sided messaging to tackle that so that people can make informed decisions. Now, do I think that risk-benefit message is going to convince somebody who's already committed to consuming raw milk to stop? No. I think it's going to help the person in the middle who's in decisional balance, considering this, to make a decision, an informed decision about it. That's my personal opinion.
A couple of things. I will say that from our agency, there is no other message. milk to be safe has to be pasteurized, and that is our message going out. But I agree with Chris. We did an extensive outreach to the Latino community who was having risk issues involving cheeses made with unpasteurized milk. And it was acknowledged. Once people knew of the risks and understood the risks, they were really readily interested in adopting the safe behavior and only drinking or eating cheeses, in this case, made with pasteurized milk. So I do think that really understanding the risks is the really important thing, and I don't think that is as really truly that information is out there.
Thank you. I know my life insurance policy is null and void if I skydive. I'm just wondering if health insurance policies shouldn't exempt raw milk, folks. Anyway, just a thought. Pat?
Hello, I'm Patricia Buck. I'm with the Center for Foodborne Illness Research and Prevention. And first of all, Shelley, I think you've put together a great conference so far. Really excited. And as I look up there at the panel, there's the 3 agencies sitting there. And we talked about, what our biggest accomplishments were, and then, of course, about what we need to do for the future. And the one thing that I recognize is that the challenges out there are much greater than what we've even begun to discuss here, because we have antibiotic-resistant pathogens on the scene. We have a growing world population, and I think it's 2050 they all talk about. We're going to have more people than we have food, which means every morsel of food is going to have to be delivered safely. And I think as a group in this room, we understand these challenges. We don't want to talk about them all the time because they're really overwhelming. And they're particularly overwhelming when it's not clear what the strategic plan is moving forward. And part of that strategic plan is where are we going to get the money to put in place the things we need to do. So we have our 3 agencies up there. Is anybody willing to help me understand how we're going to move forward?
In terms of getting money?
Well, that's part
Congress
of the equation.
decides that.
I think part of what it is, Chris, we're going to have a sea change about the importance of food and a sea change about what we're willing to do to have that safe food.
Yeah, I think you're absolutely right. And I think, we're near Washington, D.C., where they're not known for making a lot of, I don't know, I'm no comment. I'll get in trouble. But reality, we're not making headway on many issues in our culture right now. That's my personal opinion. The fact that we've got so many people gathered here around food safety, I couldn't agree more. We need strategy. We need resources. We absolutely need all these things. We need people. Regardless of political orientation, you have to eat to survive. And how can we mobilize people to say, okay, there's more people in this world, and we all need to eat. We need to eat healthfully, and we need every morsel to matter.
So we have all these working groups. Do we have a consensus from FDA and USDA and CDC of what is the next #1 thing we should tackle?
Well, I think, part of the challenge, and it's been brought up a couple times so far, is, food safety is partitioned from nutrition.
Yes.
And I think I know I've been doing research along this line, is how do we connect those 2 worlds and build a bridge? Because in consumers' minds, they're completely connected, but in our organization of different roles and problems, they're completely siloed. And I think part of the strategy is how do we get the nutrition folks and the food safety folks in the same room and develop a plan going forward saying this is what needs to happen over the next 50 years or whatever.
Okay, I'm really glad to hear you say that. Thank you, because that's part of what I believe that we do need to integrate food safety into all of our nutritional programs across the board. Thank you.
I was just going to say we've worked very hard with dietitians and the dietary guidelines for Americans, so please come forward and talk about it.
I think we're doing it, and I think that's one of the reasons that we have people like Missy Cody or Hillary here, and also myself, so I get this. So maybe you can't lobby on the Hill, but I can. And you know what? I am someone that can talk to FDA, and I can talk to Secretary Burnell, Sylvia Burnell, and also Mr. Vilsack. They get this. So the more you tell me the stories, and the more impact we have, and the more we hear about things like Dana, they get it. So I think we hear it, but I will tell you that it is a tough hole up there on Capitol Hill right now. And CDC budget is one of the hardest ones that we have to lobby for. It is really, really tough, and I don't know quite why. And I know it's harder now with Ebola. But just know that we get this. Nutrition professionals get this, whether it's in FNEP or the university. So we're out there supporting you. Just know that you have people carrying your message, because we're very proud of what you do.
Thank you. Mary Pat.
I would like to add.
That was Mary Pat Raimondi, everyone. Michelle, introduce yourself.
Oh, I'm sorry. I just wanted to add something. We were just mentioned bringing nutrition to food safety together. I can say that I'm very happy that today I have had to divide my time between this conference and an all-day working group nearby. And it's a working group developing the dietary guidance for pregnant women and children under 2 years old. And we're starting now. There will be released in 2020, so it's a long road in front of us. But they invited us, and they had us in the room with all the different components of the government that do the more like dietary part of the job. So they were very interested in our point of view, and the working group is creating the ground for, like, in the future, just not only say what is healthy for a pregnant woman, what is healthy for a small children, but also what is safe for them.
Michelle?
Good afternoon. Michelle Samara-Tim. I'm with Somerset County Department of Health. That's in New Jersey. We were good enough to receive an Innovative Food Defense grant from the FDA, so I'm going to address the query from the Ohio folks, and also for the people in the room. We created a series of print cartoon panels to be able to bring the concept of food defense down to the level of the frontline food worker, whose education, whose language barriers, whose culture and perceptions are different from the management and those who are higher. And as we did this, we also recognized that these folks also have families, and that this was also an opportunity to educate consumers. So at least one of our cartoons is talking about if you become ill, you need to report it, because for us, on two levels. One, we'll hopefully be able to get an index case from an unintentional foodborne outbreak all the sooner, and most certainly, hopefully, get the intentional food contamination sooner. So we do have that here today. It's a poster. It's the end one down on the side. And I do have thumb drives for people to take home till they run out. I'm putting the money forward. And but anyway, we have that, and it's because food defense, that see something, say something, which we used, is something that not only do we want our restaurants and our food service to know, but I do think consumers have a role in that too, because when the day comes that we have a widespread intentional outbreak, our risk communication collectively is going to be incredibly challenged, and whatever we can do to prevent that, it's going to be helpful. Thank you.
Thank you, Michelle. At this point, we are getting ready to wrap things up for the afternoon and go for our reception and posters and beer and wine. You should have a ticket. Yes, and if you're not using it, I'll take it. So anyways, I'd like to recognize our panelists here and thank them